We turn now to another story that dominated the headlines this week, the growing fears over the Zika virus. Dr. Anthony Fauci is the director of allergy and infectious diseases at the National Institutes of Health. Dr. Fauci, first, tell Americans what they can expect in terms of Zika in the United States this summer.
Well, we already have what's called travel-related cases, over 350 people who got infected in the regions in South America, the Caribbean, and are here in the United States. We very likely, though you can't say definitively, will get what we call local transmitted cases as we get into the robust mosquito season into the summer. And the reason we think that's going to happen is because infections that are quite similar to Zika, like dengue and chikungunya, which are transmitted by exactly the same mosquito and have been in the Caribbean and South America for a while, we've seen in the past little clusters of local transmitted cases within the country. The critical issue is that in the past we've successfully prevented it from becoming sustained and disseminated, and that's what we have to be prepared to do when we do get those locally transmitted cases in the United States.
To keep that from happening, to move quickly, do you need Congress has not acted yet. Is that, I mean, are we at a state of real peril here, or give us a sense of how urgent things are?
Well, we need to act, we are acting, not we need to, we are acting right now from a number of standpoints. There's a general public health standpoint, much of the work done by the Centers for Disease Control and Prevention in both their work domestically, their work in the territories like Puerto Rico, and their work internationally like in South America. At the NIH, for example, we already are starting on the development of a vaccine. There's mosquito control issues that the CDC and others are responsible because they work with the state and local health authorities. We can't wait to start those things. We're starting them right now.
What about Congress? Do they, how much more helpful would the money from Congress be?
It's more than helpful, it's necessary. I mean, that's the reason why we asked for it, because right now we're using money from other accounts to do that, and that is going to be just a stopgap measure. We're going to have to get the money to be able to do the full job that we've planned to do.
Didn't we go through this with Ebola in the sense of why doesn't Congress kind of get what you're saying?
Well, Congress gave us money for Ebola, and we did very well with Ebola. Right now, with the fiscal constraint, there's a disagreement. I mean, I don't want to get into the politics of it, but I can just tell you from a public health and a research standpoint, we do really need that resource in order to be able to get the job done.
From the public health perspective, what should pregnant women or women who are thinking of becoming pregnant in the United States, what should they do?
Well, if you're staying in the United States right now, there are no local transmitted cases. So women in the United States getting pregnant should not be worried about anything regarding pregnancy. If you're pregnant, thinking of becoming pregnant, might be pregnant, definitely you should not travel to the areas where there are outbreaks, such as South America, the Caribbean, and Central America. So the CDC travel advisory should be adhered to by pregnant women.
What if there does become a local case in the United States? Does that totally change the equation?
Well, yeah, it depends on the extent of local case in the United States. If you just have a couple of clusters that you can essentially sustain the suppression of it by not allowing it to become widespread, very likely any major change there. But if we do get widespread changes, then we're going to have to re-examine. The CDC in real time always examines what the situation is and makes recommendations accordingly. For example, we just found out over a period of several weeks that there is now sexual transmission from men to women. So there is, and from men to even a male sexual partner, there was a case of that. So the recommendation now that if you're a man and you go to this area and you might be infected and come back, you should refrain from sex or use safe sex for at least 6 months if you don't have a pregnant partner, or if you have a pregnant partner, for the entirety of the pregnancy. So one should follow those recommendations that are very well delineated by the CDC.
All right, Dr. Fauci, thank you so much for walking us through all of that.
Good to be with you.